Welcome to the 2023 NCLEX Management of Care Practice Test. This test will have 40 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it white.
Question 1. Which of the following laws allow a mentally stable patient to leave AMA against medical advice from a hospital? A. Common law. B. Precedent law. C. Civil law. D. State law. The correct answer is A. Common law. Common law allows a mentally stable patient to make their own healthcare decisions. If a patient who is mentally competent wants to leave the hospital AMA, then they have the right to do so. Question 2. You're the nurse caring for a patient who is newly diagnosed with CHF. You may ask the UAP to perform all of the following tasks, except A. Measure the patient's intake and output. B. Educate the family on the reason for strict Is and Os. C. Provide Foley care. D. Give the patient something to drink. The correct answer is B. Educate the family on the reason for strict Is and Os. An unlicensed personnel cannot educate. Therefore, having a nurse aide to educate a family on a diagnosis of CHF is not permitted. Question 3. Medical battery often occurs when a doctor or other healthcare provider denies you the chance to choose whether to get medical therapy. The act may involve touching or other objectionable behavior and is done with intention. Which of the following is an example of medical battery? A. Failure to diagnose. B. Failure to provide proper treatment. C. Performing a procedure without the consent of the patient. D. Misdiagnosis. The correct answer is C. Performing a procedure without the consent of the patient. When someone hurts another person physically when they are in a medical environment, it is called medical battery. Battery is defined as touching with the purpose to cause hurt or offense. It is harmful if it causes harm of some kind. Performing an invasive procedure without a patient's consent is an example. Question 4. As it pertains to medical competence, nurses are required to deliver a level of care that avoids or minimizes risk. What is the term for this? A. Non-beneficence. B. Veracity. C. Non-maleficence. D. Beneficence. The correct answer is C. Non-maleficence. According to the non-maleficence principle, it is wrong to cause harm to other people. Nurses are required to provide care in a way that does not cause harm to the patient. Question 5. In the event that you are unable to speak for yourself, a healthcare proxy designates a trusted individual as your agent, proxy, or representative to communicate your intentions and make healthcare choices on your behalf. The power of attorney will be the healthcare proxy. Which of the following individuals would need a healthcare proxy? A. A married man who is on the ventilator but able to communicate. B. An 87-year-old with beginning stages of dementia. C. A 20-year-old who is in a coma following an MVA. D. A deaf and mute man recovering from a stroke. The correct answer is C. A 20-year-old who is in a coma following an MVA. A 20-year-old in a coma is not able to make medical decisions for themselves. They would need a POA/healthcare proxy to make any decisions about their medical needs. Question 6. What is the name of the act that states that when a patient is admitted to a healthcare institution, the nurse has a legal obligation to explain and educate the patient about advanced directives? A. Patient Self-Determination Act of 1990. B. Healthcare Proxy Act of 1970. C. Power of Attorney Act of 1992. D. Legal Determination Act of 1975. The correct answer is A. Patient Self-Determination Act of 1990. Compliance with the Patient Self-Determination Act, PSDA, of federal legislation is required. The aim of this law is to guarantee that patients' rights to informed consent and protection in healthcare choices are upheld. This means that all education should be provided to patients so that they may make an informed decision when it comes to their health. Question 7. Which of the following ensures that patients receive appropriate care, patient independence and decision-making rights, patient respect, privacy, and access to a complaints mechanism? A. The Healthcare Act of 2010. B. The Patient's Bill of Rights. C. The Health Insurance Portability and Accountability Act. D. The Patient's Civil Rights. The correct answer is B. The Patient's Bill of Rights. The patient's Bill of Rights ensures that the patient is entitled to appropriate care, that they can independently make their own healthcare decisions, that they are entitled to respect and privacy, and that they have someone/some entity to complain to when these Bill of Rights are not upheld. Each hospital should have the Bill of Rights in a place for patients to view freely. Question 8. It is imperative that the nurse advocate for the patient. Which of the following best describes a nurse advocating for a patient? A. Giving an opinion on different medical treatments so that the patient can pick the best option. B. Telling a patient who the best surgeon in the hospital is to perform his/her surgery. C. Explaining test results in depth after a physician has given the initial results. D. Telling the patient that it is best for her to take her medications so that she does not become more ill. The correct answer is C. Explaining test results in depth after a physician has given the initial results. Nurses act as advocates for patients in many ways. One way is to explain anything that the patient does not understand. If a physician explains something to a patient and they do not understand it, it is your job as the nurse to ensure that they do. This is an example of advocating for your patient. Question 9. What is the term for something that often entails giving responsibility for the outcome while assigning non-licensed assistance people to execute activities or duties linked to patient care? A. Delegation. B. Autonomy. C. Beneficence. D. Validation. The correct answer is A. Delegation. Delegation often entails giving responsibility for the outcome while assigning non-licensed assistance people to execute activities or duties linked to patient care. Making nursing decisions is a responsibility that can only be assigned by a qualified nurse. Question 10. What is the term for a collaborative approach that supports suggested treatment plans to ensure that patients with disabilities, illnesses, or injuries receive the proper medical care? A. Delegation. B. Case management. C. Care plan. D. Clinical approach. The correct answer is B. Case management. A collaborative process of assessment, planning, facilitation, care coordination, evaluation, and advocacy for alternatives and services to address an individual's and family's complete health needs. To encourage high-quality, cost-effective results through communication and the use of existing resources. Question 11. You're a nurse working in the intensive care unit. A person calls and states that he is your patient's pastor and wants to update the prayer log about how the patient is doing. The pastor is not on the patient's chart of people to share health information with. What is the correct action for you to take? A. Give the pastor an update since clergy and members of the church are a necessary part of the healthcare team. B. Tell the pastor to call the patient's room. C. Explain to the pastor that you are not allowed to give the information requested because he is not on the patient's chart to give out information to. D. Tell the pastor to call the family and request the information. The correct answer is C. Explain to the pastor that you are not allowed to give the information requested because he is not on the patient's chart to give out information to. The pastor is not on the patient's list of persons to share PHI with. Therefore, it is the nurse's responsibility to kindly explain that to the pastor and not give out the PHI. Question 12. What is the name of the federal legislation that mandated the development of national standards to prevent the disclosure of sensitive patient health information without the patient's knowledge or consent? A. The Self-Delegation Act of 2000. B. The Health Insurance Portability and Accountability Act of 1996. C. The Civil Law Act of 1979. D. The Health Insurance Portability and Accessibility Act of 1996. The correct answer is B. The Health Insurance Portability and Accountability Act of 1996. A federal legislation known as the Health Insurance Portability and Accountability Act of 1996, HIPAA, mandated the development of national standards to prevent the disclosure of sensitive patient health information without the patient's knowledge or consent. It was signed by Bill Clinton on August 21, 1996. Question 13. You're the case management nurse trying to receive placement into a skilled nursing facility for a patient. You have to ensure that you maintain HIPAA during this process. Which of the following information is not okay to provide the SNF? A. The patient's name, DOB, length of stay. B. The patient's insurance information. C. The bill statement from your facility hospital. D. The patient's social security number. The correct answer is C. The bill statement from your facility hospital. Only information that is used to provide care to the patient can be given to a facility that you are transferring the patient to. A billing statement from your facility does not aid in the care of the patient. Question 14. Upon discharge to a skilled nursing facility, you're gathering the patient's medical records for the patient to have a physical copy to take to the facility with them. Which of the following is not necessary to send? A. A copy of the patient's current medication list, as it will likely change at the new facility. B. An appointment with their specialist in 4 weeks. C. The patient's room number at the hospital. D. A complete history and physical. The correct answer is C. The patient's room number at the hospital. It is important to provide documentation to another healthcare entity that will provide continuity of care for the patient. However, the patient's hospital room number is not necessary information. Question 15. A nurse has just received report on her patients on a medical surgical unit. Which of the following patients will the nurse assess first? A. A patient on a cardizem drip with a normal rate and rhythm. B. A patient with a history of stroke experiencing new onset facial drooping. C. A patient with COPD with an O2 SAT of 89. D. A patient with an infiltrated IV that has been stopped. The correct answer is B. A patient with a history of stroke experiencing new onset facial drooping. The nurse must assess the patient who is least stable. A patient with a history of strokes experiencing new facial drooping is possibly having a stroke currently and needs to be assessed immediately. Question 16. A patient is scheduled for a procedure, and the surgeon asks the nurse to ensure the patient understands the benefits and risks of the procedure and has signed informed consent. What is the correct response from the nurse to the surgeon? A. The patient has already signed the informed consent. B. The surgeon must obtain informed consent for the patient. C. The patient's surgery needs to be rescheduled. D. I will not obtain informed consent. The correct answer is B. The surgeon must obtain informed consent for the patient. Only the surgeon to perform the surgery/procedure is allowed to obtain consent. A nurse's job is to witness the informed consent. Question 17. You're caring for a patient that has an order for PRBCs. What statement by the patient would cause you the most concern? A. I feel tired and weak. B. I am starting to have chills. C. I am feeling nervous. D. I am feeling restless. The correct answer is B. I am starting to have chills. A patient with PRBCs infusing who begins having chills may be experiencing an allergic reaction to the PRBCs. It is important that the PRBCs be stopped and the patient be assessed immediately. Question 18. Which of the following is not a required element of informed consent for an invasive procedure? A. Risks and benefits. B. Opportunity for the patient to ask questions. C. The MD states alternative options. D. Describing the intervention. The correct answer is B. Opportunity for the patient to ask questions. Medical professionals should describe the planned intervention, emphasize the patient's decision-making role, explore alternatives to the proposed intervention, and clarify the dangers of the proposed intervention as part of the process of obtaining informed consent. In this situation, discussing all hazards is essential for informed consent. Question 19. A nurse is caring for a patient newly diagnosed with a stroke. The nurse forgets to give the patient his blood thinner for 2 shifts. The patient suffered a stroke the next day. Which of the following can the nurse be charged with in the court of law? A. Malpractice. B. Assault. C. Negligence. D. Failure to comply. The correct answer is C. Negligence. This case presents a probable instance of nursing malpractice. When a patient suffers injury as a result of an accidental action or omission to behave as another reasonable person would, this is considered negligence. A violation of the duty of care is present. Malpractice varies from negligence in that it contains the element of purpose or intent. State laws vary, but generally speaking, any circumstance in which a nurse fails to execute his or her responsibilities adequately and harm results to the patient may be grounds for malpractice. Question 20. The nurse is working at a hospital that uses a reporting system when nurses make mistakes such as wrong medication mistakes. Nurses are not necessarily in trouble when they have a report filed against them. Instead, these reports are used to ensure that others learn from the mistakes made and that they do not happen again. What is this process known as? A. Quality improvement. B. Continuity of care. C. Nurse rehabilitation. D. Employee rehabilitation. The correct answer is A. Quality improvement. The process of meeting or exceeding patient expectations for treatment quality and targeted results is known as quality improvement or performance improvement. This method includes identifying issues, acquiring data, and assessing shortcomings or weak points in the care process. In order to guarantee that all of the patient's health outcomes are met, continuity of care refers to effective communication between various healthcare departments and/or agencies, as well as the patient. Question 21. A patient that came into the hospital originally for what he thought was pneumonia had an order for a full code. After some time in the hospital, the patient was diagnosed with stage IV lung cancer and decided he wants to be a DNR. The wife approaches you and asks about obtaining a DNR. What is the appropriate response by the nurse? A. Are you sure that's what you and the patient want? B. When the physician gets here, I will have him come in so that we can sign the DNR together. C. Okay, let me talk to your husband so that I can be sure that this is what he wants. D. I will come speak to you and your husband and have the doctor write the DNR orders in the computer, and I'll have your husband sign. The correct answer is D. I will come speak to you and your husband and have the doctor write the DNR orders in the computer, and I'll have your husband sign. It is the job of the nurse to help the patient with any legal documents that the patient desires help with about their medical care. Option D acknowledges the patient's wishes and also tells the patient and his wife what the procedure is of changing from a full code to a DNR. Question 22. You're in the cath lab with a patient about to have a cardiac stent placed. The patient begins asking a lot of questions about the procedure. You check the patient's chart and see that the informed consent was not signed. What is your next intervention? A. Explain the procedure to the patient and have them sign the informed consent. B. Tell the patient that the procedure must be rescheduled. C. Call the cardiologist that will be performing the procedure to have them obtain informed consent for the patient. D. Wait until the cardiologist gets into the cath lab to obtain informed consent. The correct answer is C. Call the cardiologist that will be performing the procedure to have them obtain informed consent for the patient. The surgeon performing the surgery/procedure must obtain informed consent for a patient. The nurse is only allowed to witness the informed consent. Postponing the procedure is not necessary. The informed consent needs to be obtained before the cardiologist comes into the cath lab, because once the cardiologist comes into the cath lab, they are usually ready to begin the procedure. Question 23. Which of the following is not one of the 5 rights of delegation? A. Right task. B. Right personnel. C. Right communication. D. Right time. The correct answer is D. Right time. Right time is a right of medication administration. The nurse delegating the task must ensure it's a task that can be delegated and to which personnel. The nurse is also responsible for the proper communication so that the task that is delegated is done properly. Question 24. You're an ER nurse assessing an elderly adult patient with bruises that are in different stages of healing. Her caregiver is at the bedside as well. What is your most important intervention? A. Report the bruising to the physician. B. Document the bruising in the patient's chart. C. Ask the patient where she obtained the bruising. D. Ask the patient's caregiver where the patient got the bruises. The correct answer is A. Report the bruising to the physician. Bruising in different stages of healing often means that the patient is being abused. This should be reported to the physician immediately. Question 25. You're caring for a patient who is in a coma and intubated. He has been at the hospital for several days without any family or friends visiting. A woman shows up at the patient's bedside and states that she is his POA, power of attorney. However, the woman does not have legal paperwork proving that she is the POA of the patient. What is your response to the woman? A. You will have to bring legal documentation for the patient's chart. B. I will write you in the patient's chart as his POA. C. Once the patient wakes up, we can ask him to confirm that you are his POA. D. I will need you to prove that you are the patient's POA. The correct answer is A. You will have to bring legal documentation for the patient's chart. A person cannot show up to a hospital and simply state that they have a POA of a patient. Legal documentation is needed in order for a person to make healthcare decisions on behalf of a patient. Question 26. The nurse is caring for a patient who is 1 day post-op from a total hysterectomy. The patient is refusing to walk. The nurse has made every effort to encourage the patient to walk. What should the nurse do? A. Notify the physician that the patient is non-compliant. B. Document the patient's refusal in the patient's chart. C. Tell the patient that she will not be able to go home until she walks. D. Tell the patient that you will be telling the doctor of her refusal to walk. The correct answer is B. Document the patient's refusal in the patient's chart. A nurse cannot make a patient walk if they are refusing. The physician should be notified of the patient's refusal, but usually if the nurse documents the refusal in the patient's chart, the physician can see it when reviewing the patient's chart. The refusal is not a reason to call the physician right away. Question 27. You're the nurse caring for a homeless patient. The day for his discharge is near, and he explains to you that he is worried about leaving the hospital due to lack of food and medications. Which of the following should you refer the patient to? A. Dietitian. B. Pharmacist. C. Social worker. D. Chaplain. The correct answer is C. Social worker. A social worker can be a great resource for patients. Social workers can help with things such as insurance, food waivers, transportation resources, and so much more. Question 28. You're caring for a patient with multiple wounds that need daily dressings, uncontrolled diabetes, mellitus type 2, and uncontrolled hypertension. The patient is mentally competent and states that he wants to leave now and threatens to become hostile. What should you do as the nurse? A. Obtain AMA forms and inform the doctor of the patient's wishes. B. Explain to the patient that you cannot let him leave in his condition. C. Call a taxi for the patient. D. Have a chaplain come speak to the patient. The correct answer is A. Obtain AMA forms and inform the doctor of the patient's wishes. A patient who is in a healthy mental state is allowed to leave the hospital against medical advice. The doctor must be notified. The AMA papers should be obtained and signed by the patient and the healthcare team. Question 29. You're caring for a patient who is leaving the hospital with daily wound care orders, home oxygen, and a PICC line for daily IV antibiotics. Which member of the healthcare team can most effectively assist this patient in obtaining all things needed to go home and have continued care? A. Occupational therapist. B. Case manager. C. Charge nurse. D. DME company. The correct answer is B. Case manager. The case manager is a liaison to help a patient transition from hospital care to home care as easily as possible. They can set up a patient with home health that needs things like wound care, home oxygen, and daily antibiotics. Question 30. You receive orders for penicillin G for a patient who has an allergy to penicillin listed in his chart. What should your initial step be? A. Report the doctor to the Board of Medicine for malpractice. B. Clarify the order with the doctor. C. Refuse the order and do not give to the patient. D. Tell the patient the doctor is incompetent. The correct answer is B. Clarify the order with the doctor. If a patient has an allergy to a medication that has been prescribed, the order should always be clarified with the doctor. When in doubt, always clarify an order with the doctor that wrote the order. Question 31. You are a nurse on a medical surgical floor with 4 patients with medications due at 9 a.m. Which of the following patients will you administer medications to first? A. A patient taking lactulose for high levels of ammonia upon hospital admission 3 days ago. B. A patient taking Humulin R that is about to receive their breakfast. C. A patient on Demerol for post-op pain with a pain level of 510. D. A patient on metoprolol for a chronic history of irregular heart rhythm. The correct answer is B. A patient taking Humulin R that is about to receive their breakfast. Regular insulin for diabetic patients should be delivered 15 to 30 minutes before the meal. This medicine administration is urgent and time-sensitive. Instead of prioritizing medications merely on the basis of age, priority should be given to the illnesses they treat and the status of the client who needs them. Question 32. You're receiving report on your patients on a medical surgical unit. A patient's family member yells from a patient's bedside, "He's not breathing." What is your initial response? A. Have the nurse that is taking over the patient assess the patient. B. Stop report and assess the patient. C. Ask the family member to wait until you're done receiving report. D. Have the nurse aide assess the patient while you are receiving report. The correct answer is B. Stop report and assess the patient. The patient is in immediate need of nursing help. No matter who is taking over care of the patient, the nurse's priority should be assessing the patient. Question 33. Which of the following patients should be assessed first? A. A patient with a chest tube with a water seal chamber that is dry. B. A patient with a Foley catheter bag that is overly full. C. A patient with stable AFib. D. A patient with COPD sleeping with a pulse ox of 90%. The correct answer is A. A patient with a chest tube with a water seal chamber that is dry. The patient with the chest tube with a dry water seal chamber should be seen first because an improperly working chest tube can cause respiratory distress in a patient. The overly full Foley catheter bag can be delegated to a UAP. Option C states that the patient is stable. Option D is also a stable patient. Question 34. You're caring for a female patient that insists that the male nurse on the previous shift was inappropriate with her. What is your best response to the patient? A. How was he inappropriate with you? B. I can report this to our charge nurse and have her come speak to you so that you can tell her your concerns. C. I will speak to him about that. I am so sorry that he made you feel uncomfortable. D. I will report him to the Board of Nursing. The correct answer is B. I can report this to our charge nurse and have her come speak to you so that you can tell her your concerns. The nurse should always validate the patient's concerns. The nurse should never take it upon herself to talk to the offender. Nurse. Reporting the nurse to the Board of Nursing without knowledge of what was said/done is not appropriate. Reporting the situation to the charge nurse is the best option. Question 35. You're running behind during your morning medication pass because several patients needed PRN pain medications. What is an appropriate task to delegate to the LPN on the unit? A. Ask the LPN to take vital signs on a patient with unstable hypertension and a suspected stroke. B. Administer IV penicillin to a patient with a CVL. C. Ask the LPN to administer IM Phenergan to a patient with nausea. D. Ask the LPN to assess a post-op patient with an abdominal binder on. The correct answer is C. Ask the LPN to administer IM Phenergan to a patient with nausea. The LPN may administer most IM drugs. The LPN should not obtain vitals on a patient who is unstable, as in option A. LPNs are unable to access a CVL or PICC. Option D suggests that the LPN assess. Assessment is the duty of the RN. Question 36. A patient comes into the ED complaining of chest pain that radiates down his left arm. His VS are as follows: HR 140, SAO 298%, RR 22, and BP 145/95. What is your priority? A. Recheck the BP. B. Get an EKG. C. Administer oxygen. D. Start a 20-gauge IV. The correct answer is B. Get an EKG. This patient is having symptoms of a MI and should have an EKG done immediately. The other options are correct but are not most important. Question 37. You notice that there is a blood spill in the hallway on your unit. What is your initial intervention? A. Call EVS. B. Call the biohazard team. C. Wipe the blood up and clean with the proper wipes. D. Place a caution cone beside the spill and call EVS. The correct answer is C. Wipe the blood up and clean with the proper wipes. Calling EVS is okay, but to keep patients and visitors safe, the blood spill needs to be wiped up immediately. Linens used to wipe up the blood should be placed in a red biohazard bag. Question 38. You're coming on shift and you're assessing the equipment in your patient's room. You notice that the patient's SCD machine's electrical cord is frayed, and the patient has orders to use the SCDs while in bed. What is your best intervention? A. Call maintenance to repair the machine. B. Put electrical wire around the electrical cord and call maintenance. C. Put in a work order for maintenance to repair tomorrow. D. Remove the equipment and replace it with a new machine. The correct answer is D. Remove the equipment and replace it with a new machine. The frayed electrical cord poses harm and risk of electrical shock to the patient. The machine should be removed and replaced with a new one immediately. You can then put in a work order for maintenance to repair the broken machine. Question 39. You're caring for a patient on vancomycin for severe cellulitis in his leg. The patient reports that he feels weak. You take his BP and it reads 85/48. You wait 5 minutes and recheck the patient's BP and it is 90/50. What is your immediate intervention? A. Record the BP in the patient's chart. B. Tell the patient that you will reassess his BP in 1 hour. C. Ask the nurse aide to recheck the patient's BP in 30 minutes. D. Inform the MD immediately. The correct answer is D. Inform the MD immediately. The patient is experiencing hypertension while on a strong antibiotic for an infection. This suggests that the patient is experiencing septic shock. The MD should be informed immediately. Question 40. You are caring for a patient that is a frequent flyer and is in and out of the hospital needing blood products. He comes onto your unit and has PRBCs ordered. He does not have a blood consent signed for this admission. What do you conclude? A. His blood consent from last admission may be used since he frequently receives blood transfusions. B. He will need a new blood consent signed before you can administer PRBCs. C. You can begin the transfusion and then receive consent since you know this patient. D. You can obtain a blood consent from his previous admission from the blood bank in the hospital. The correct answer is B. He will need a new blood consent signed before you can administer PRBCs. In most facilities, it is mandatory to receive a new blood consent with each admission. A new cross-match and sensitivity should be performed with each new hospital admission as well.
Thank you for watching this video. We hope you enjoyed it. Click the first link in the description to take the free NCLEX practice test. Also, check out these videos that can help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel, and please share this video with your fellow nursing friends.